Welcome. Let's start with our first question. A client with heart failure gains 2.5 kilograms in 24 hours. What is the nurse's priority action? Now, consider your options. Is the answer A, restrict fluids? Is it possible that it's B, notify the provider? Maybe you think it's C, encourage ambulation. Finally, D, document the finding. Time is up. The correct answer is notify the provider. Alright, let's dive into our next question. A nurse is caring for a client on contact precautions. Which action is appropriate? Now, consider your options. Is the answer A, wear an N95 mask? Maybe you think it's B, use sterile gloves. Is it possible that it's C, don gloves before entering? Finally, D, remove PPE outside room. Time is up. The correct answer is remove PPE outside room. Moving on to question number 3. A client with chronic kidney disease has peaked T waves on ECG. What is the nurse's priority action? Now, consider your options. Is the answer A, administer calcium gluconate? Perhaps B, restrict potassium? Or is it C, obtain vital signs? Finally, D, encourage fluids. Time is up. The correct answer is administer calcium gluconate. Moving on to question number 4. A nurse notes sudden onset of unilateral weakness and slurred speech. What should the nurse do first? Now, consider your options. Is the answer A, check blood pressure? Or is it B, perform neuro assessment? Maybe you think it's C, activate stroke protocol. Finally, D, obtain glucose level. Time is up. The correct answer is activate stroke protocol.